Hello students, welcome to Distinction Learning Platform, and on this platform you find expansion to difficult topics, you find revisions, a lot of stuff. So before we begin our lessons, make sure that you subscribe so that you can be updated to all our upcoming videos. To make the story short, let us begin. Okay, so in this video we're talking about hypertensive disorders in pregnancy. Remember that this is the clinical part of medical students, and this is under OBG, which is obstetric and also gynecological parts of session. Okay, so now what are hypertensive disorders in pregnancy? So basically, what is hypertension in pregnancy? So hypertension basically is just the sustained elevation of blood pressure greater than what 140 systolic, and also greater than what 90 diastolic blood pressure. Okay, and it has to be measured at least on two separate occasions, at least 4 to 6 hours apart. That is what the proper definition for hypertension in pregnancy. So what are we saying? We're saying these are what? So it starts what? Elevation of what? Blood pressure greater than what? We're saying 140 systolic and 90 diastolic, measured at least what? 2 separate what? Occasion. Okay, occasion, which is the 4 to 6 hours what? Apart. So these 2 separate occasions, there has to be 4 to 6 hours what? Apart, for you to be sure that someone is having hypertension. Okay, now this same hypertension, if you look at it, it's a very common what disorder that is affecting pregnant women. Okay, and it affects about 10% of all pregnancies that are going to be what? There. Okay, so now what are the categories of hypertensive disorders in pregnancy? Basically, hypertensive disorders in pregnancy, they are further categorized into what? 4 categories. Very important. What is the first one? The first one is what? Gestational hypertension. What is the first one? The first one is what? Gestational hypertension. The one that we'll talk about here, gestational hypertension. It is gestational hypertension we'll talk about here. Although gestational hypertension basically is a type of hypertensive disorder that will occur in pregnancy for the first time, and it has to be greater than 20 weeks. We'll talk about it. Okay, so that's the first one, gestational hypertension. What else? There is also pre-eclampsia, eclampsia. Okay, we'll talk about it there in details as well from the other part. Okay, the pathophysiology of pre-eclampsia, which is a very important one, clinical features, diagnosis, and also management. We'll talk about that. Then what else? Apart from that, so there are 4 categories. There is also chronic hypertension. Maybe someone had already hypertension before being pregnant. Okay, so that will categorize as what? Chronic hypertension in what? Pregnancy. So what are we saying? There is also what we call chronic hypertension in pregnancy as well. Okay, what is the last one? You will find that to say there will be a mix. Okay, so chronic hypertension, so there will be now superimposed pre-eclampsia on chronic hypertension. So what are we saying? There is also another one, superimposed pre-eclampsia on what? Chronic hypertension. Okay, so now someone had chronic hypertension. Now all of a sudden they develop as well pre-eclampsia. So that is also the final category of what? Hypertensive disorders in pregnancy. Okay, so now let us start with a gestational hypertension. Okay, so what is gestational hypertension? So gestational hypertension basically is a sustained or elevated blood pressure greater than what? 140 systolic, and also greater than 90 diastolic, which is also measured on 2 separate occasions, 4 to 6 hours apart, And the most important thing is what? There is no proteinuria. There are no proteins in urine that you are going to see. Okay, that is a very, very important what? Important part that you need to understand. So what I saying about gestational hypertension? Sometimes gestational hypertension can be it has another name which we call non-proteinuric pregnancy-induced hypertension. So they can use that pregnancy-induced hypertension or non-proteinuric pregnancy-induced hypertension. So that is another way of saying gestational hypertension. So what are we saying? What's a proper definition of hypertension? Gestational hypertension. We are saying elevation of what? Blood pressure of greater than what? Greater than 140 systolic and greater than what? 90 diastolic. Okay, measured on what? Two separate what? Occasion as well. Okay, two separate occasion and also 4 to 6 hours what? Apart. But what is the most important things to know about that? No proteinuria. Very, very, very important. No proteinuria. But again, under gestational hypertension, someone with gestational hypertension, okay, out of all pregnancies, but 1/3 can the 1/3 of those patients, they are going to have an increased risk of developing what? Pre-eclampsia. So basically, someone can also have gestational hypertension as well as they can have what? Which is pre-eclampsia. Very, very important one. So what's the other one? What is the other important aspect about gestational hypertension? Remember that also weeks are very important to include in the definition, and this has to be what? Greater than 2 weeks or 20 weeks or what? Gestation period. So what are we saying? Gestational hypertension as well, apart from not having not having proteins in urine, then they are going to, this gestational hypertension develops after what? 20 weeks. Okay, always. So now what is the full definition of gestational hypertension? So gestational hypertension is sustained elevation of what? Blood pressure greater than what? 140, greater than what? 90 diastolic and systolic. Then what else? Also, there will be what? No protein that are going to be what? Found in the urine collection or 24-hour urine collection, and also it has to be 4 to 6 hours apart, greater than what? 20 weeks gestation period. Very, very important. Okay, and there is also another one that has been proposed, because according to OBGY, you need to have more definition to satisfy maybe the examiner. So what else? There is also, if you look at the diastolic blood pressure, okay, if it is greater than 110, okay, so again they are saying diastolic blood pressure, so they are saying here diastolic blood pressure greater than what? Greater than 110. Very, very important as well. So greater than 110, just measured on what? One occasion. So this one has to just be measured on what? One occasion. Okay. And this diastolic blood pressure, which is greater than 110, is a very, very dangerous what? Type of hypertension. If you measure something like that, then it's indicating what? An emergency. Why? Because if someone is having that diastolic blood pressure, they can have now some certain symptoms. Okay, symptoms of what? Pre-eclampsia. And you know that pre-eclampsia is something that is a very, very what? Severe disease. Okay, now, so when I'm wasting time, let's go to the diagnosis. So how can you diagnose someone who is having gestational hypertension? So gestational hypertension is something that is not it's something that is not severe compared to pre-eclampsia. It's not problematic. So now, what's the diagnosis? So we follow the first one is what? You look at the clinical features. So you look at the history of a patient, whereby you ask about if they are having abdominal pain, which is maybe a gastric pain. Ask about that. What else? If they are having visual disturbances and what? Headache. So what's the first thing that you need to understand? And why are you asking those questions? Because the differential diagnosis of this gestational hypertension is what? Pre-eclampsia. So make sure that you ask about the symptoms that can lead to the diagnosis of what? Pre-eclampsia. So what can you say? The first one is what? you talk about history of what? History of, we're saying visual disturbance. Okay, visual disturbance. What else? What else are we supposed to talk about? Headache. Ask about headache. Okay. Apart from headache, also epigastric pain. Okay, pain as well, epigastric pain. Ask about that. So those are the very important things that you need to ask. So people with gestational hypertension, they are not going to have visual disturbance, headache, epigastric pain. They are not going to have that. Okay. What else? Okay. Another thing that you need to do is very important for you to do lab. Okay. You do the 24-hour urine collection. Okay. So you need to collect urine, and if you find no proteins there, so that is also important. So no proteins in urine. Okay, no proteins in what? 24-hour collection of urine. Collection of what? Urine. You're not going to find in what? Proteins there. Okay, very important. So these are the things that you can see for someone having gestational hypertension. But what else? Now let's talk about management of gestational hypertension. What is the management? Basically, people with gestational hypertension is not problematic. So basically, what they do is it's just under conservative management. Sometimes, okay, medical management will be also there. Okay, so conservative management, basically you encourage a patient coming forward antenatal care visit. Okay, like before 28 weeks, you encourage them coming after 2 weeks. Okay, then after 28 weeks, then you encourage them to be coming weekly. Okay, then during the antenatal visit as well, you need to be taking the blood count. Okay. You need to be taking you need to do urinalysis for protein, so that you observe if there's a progression to what which is pre-eclampsia. Okay, then apart from that, if you talk about you can also commence the medical management, which is the management of hypertension. Okay, you can start with some certain drugs like hydralazine. Okay, you can do hydrazine. You can also give them methyldopa. You can give them nifedipine. So a lot of medical things. Okay, and if it comes to delivery, if the BPs and everything are normal, basically can do a vaginal delivery. If there are no contraindication to vaginal delivery, you can do that. And also you can, if you do vaginal delivery, you can also do during vaginal delivery, you can also do active management of third stage of labor. Okay, you can also commence on that. Okay, very important to take note. But if someone has some contraindication to the vaginal delivery, then what can you do? You can do C-section as well. Okay, so that's about gestational hypertension. Then let's go to another one, an interesting one, which is pre-eclampsia. So what is pre-eclampsia? And you need to know the difference between pre-eclampsia and gestational hypertension. So let's go to pre-eclampsia. What is pre-eclampsia? So pre-eclampsia basically is also sustained elevation of what? Blood pressure greater than 140, and also greater than 90 systolic and diastolic, measured at two separate occasion, 4 to 6 hours apart. But there will be presence of proteins in the urine, which is proteinuria, very important. And as well as there will be epigastric pain, there will be headache, and visual disturbance. So those are the main features you can use to differentiate between gestational hypertension and pre-eclampsia. So what are we saying? So that's basically the same definition, but we are going to have some differences when it comes to proteins, as well as if you talk about the gestation age as well, it has to arise after 20 weeks. Make sure that you understand that. Okay, so what are we saying? So what we are saying is this. So we are saying this is the same definition now. Pre-eclampsia is further categorized into two. There is what we call mild pre-eclampsia. So let's just say PE, mild pre-eclampsia, and severe. So let's say severe PE. Okay. So this pre-eclampsia itself, it is further categorized into two: mild and severe pre-eclampsia. Okay, so now again, you also have to what differentiate between mild preeclampsia and what severe preeclampsia. Very important. So now, what is mild preeclampsia? Mild preeclampsia, basically, if you talk about the BP, although it's greater than 140 and 90, here there is a range. So for mild preeclampsia, when it comes to what BP, okay, it has to be what the systolic, it has to be 40 to 159 over diastolic, it has to be what 90 to 109. Very, very important part. So if the BP is on in this range for systolic and the diastolic, basically someone is having what mild preeclampsia. Okay, what else apart from that? Then if you talk about the symptoms, okay, the symptoms for preeclampsia, so this one, there are no symptoms like epigastric pain. So here we're saying no what epigastric pain. Okay, no what, no visual disturbances, no visual disturbances. Okay, what else? No, again, what else apart from that? Headaches. Okay, so on mild you don't see those symptoms. Very, very important. Okay, but what you can differentiate this one from that one, here they are what, the proteins are what, positive. Proteins in urine are what, positive. Now if you talk about proteins, how much proteins are there in the what, in urine, make sure that you know also the amount of proteins that are there. So basically they say greater than what, 300 milligrams of proteins that are going to be collected. So what are we saying? According to proteins, it will be what, greater than what, greater than 300 milligrams of what, proteins per 24-hour collection of what, urine. Very, very important one. So those are the things that you need to understand about the what, the blood pressure, but the mild preeclampsia. So there's a first, so the triad that we've now understood here. So what is the triad that we know? So from the mild, the triad, what do we know? The triad. So if you want to use the diagnosis for mild preeclampsia, what do you know? The first one is what? Okay, the first one is this should develop after what? 20 weeks, greater than what? 20 weeks gestation age. Okay, what else? Okay, the BPs that we've talked about, these ones, and what's the last one? Okay, the last one are what? Presence of what? Proteins greater than what? 300 milligrams. That's a triad that you need to know. Greater than 20 weeks, blood pressure elevation of starting from 140 to 159 or 90 to 109, and there has to be what, proteins which are greater than or equal to what, 300 milligrams of proteins. But if you do the dipstick, it's going to give you 1 to 2 plus positive what, proteins. Okay, so that's a triad for what, mild preeclampsia. What about the severe preeclampsia? Severe preeclampsia as well. Now, if you talk about the blood pressure, this one, it is more interesting. Make sure that you understand this one. So if you talk about the blood pressure, this one, for the blood pressure, it is greater than what? It's greater than 160 here. And for systolic, it's greater than 160 limit of mercury. Then what about the diastolic? It should be greater than what? 110. Okay, very, very important. What about now, if we talk about the symptoms, here there will be what? Positive what? Epigastric pain. What else? There will be positive headaches. Okay, what else? Positive what? Visual disturbances. So these are very, very important what? Symptoms that you are not going to observe under severe preeclampsia. So what else? The other thing that you need to observe is about the proteins as well. So basically, proteins has to be positive. Why? Because you need to differentiate those the presence of proteins. It will help you to differentiate from what? Gestational hypertension, because gestational hypertension doesn't have what? Proteinuria. Very, very important. Now, how much proteins are going to be present in what? Severe preeclampsia. So it has to be what? This one, greater than what? 5 grams. Okay, per 24-hour urine collection. Very, very important. So after a day, you're going to collect about what? 5 grams of protein in urine. Very, very important. Now, under this one, there are 2 triads that you're going to observe. Here we talked about just one triad, greater than 20 weeks, BP, elevation like that, then 800 milligrams. Now here it has two important triads, because under diagnosis, sometimes they can give you what? Triad number 2, okay? So if you fail to diagnose severe pre-eclampsia, basically all the questions that you're going to have during an exam, you're going to fail, okay? So now what are those 2 triads? The first one is what? First triad, okay? So I'll write it here. What is the first triad number 1? Triad number 1. What is the first one? The first one is, if you talk about this has to arise greater than what? 20 weeks gestation age, okay? 20 weeks, after 20 weeks, then you're going to have hypertension with those BPs. So the BP as well, that's the same as that one. The BP, now the BP has to be greater than what? We know that is 160 over what? 110. Okay. What else? What is the last one? The last one is this one, the proteins. The proteins should be greater than what? 5 grams per 24-hour urine collection. Very, very important. Okay. This is triad number 1. This is the thing that you can use to diagnose severe preeclampsia. So this is triad number 1. What about triad number 2? Very important. So triad number 2, quite alright. This one, the 20 weeks gestation age is what? Is always there. Okay, that's the first one. That's the first important thing. What is the now? What about the blood pressure? Now for triad number 2, most of the students, they're going to be confused when it comes to blood pressure. Blood pressure can be at least like this one. It can be like for mild, which is greater than 140, like mild. That's less than 160. So for systolic, 140, greater than 140, and diastolic greater than what? 90. Okay. Then what else? Then the last one is very, very important. The presence of what? The presence of these. Very, very important. So make sure that you understand. So triad number 2 is going to have what? The greater than 20 weeks gestation age, blood pressure like mild pre-eclampsia. Okay, 140 over 90. But if you see gastric pain, headache, and visual disturbance, maybe seizures and other things, liver hematoma, HELP syndrome, those things, if you see now someone is having what? Severe eclampsia. Make sure that you understand that, because during an exam, if you fail to differentiate between mild and severe preeclampsia, you're going to fail all the subsequent what? Questions. So that's about that. Now, the question is, what are the risk factors for someone to develop what? Pre-eclampsia. What are those risk factors? Very, very important, because they also ask about the risk factors. Okay, so what are the risk factors for someone to develop pre-eclampsia? We know the first one is what? Prime pars. Okay, what is the first one? The first one is these prime pars people or women. Okay, prime pars people or women, they are going to have about the 8 times risks of developing what? This pre-eclampsia syndrome. Okay, so there is a reason why prime pars are going to develop this pre-eclampsia. Is because of they say it's because of genetic, that fetal maternal transfusion. The maternal, the mother, is going to be sensitized to what? To the fetal proteins. Then the immune system is going to be activated. Then after that, cytokines will be produced. So they are and also leading to what? Vasoconstriction of systemic blood vessel, leading to what? Hypertension. But there are a lot of what? There are a lot of theories that have been produced why prime pars are going to have about 8 times risk of developing what? Pre-eclampsia. There are a lot of theories for that. Okay. What else apart from that? We know. What about the mouth pars? Mouth pars. Okay, mouth pars. Basically, they are going to have increases of having that, but mouth pars with previous what? History of what? Pre-eclampsia. So we're saying history of what? PE. So mouth pars with a history of what? Pre-eclampsia. What else? We also have another one. Apart from that, we also have history, family history. So let's put family history. Okay, family history of what? PE from the what? First degree relative, like the mother and the sister. Okay, that is also the risk factor. What else? Okay, also molar pregnancy. So molar pregnancy, very very important. We'll talk about it in future for gyne session. Okay, molar pregnancy also has some risk factors. It is a risk factor for developing what? Pre-eclampsia. What else? There's also another one, a very very important one, which we call medical BMI. So someone who is obese. So BMI greater than what we know, greater than what? Greater than 35, like that, they also have increased risk of developing what? Pre-eclampsia, and some certain what? Medical condition. Like what? So we're saying also some what? Certain medical conditions. Certain medical conditions. Certain medical condition like what? We have maybe someone having gestational diabetes, someone having chronic hypertension, renal disease, a lot of what? Medical condition predisposing someone to have what? Pre-eclampsia. That's a lot.